In this video I will be discussing the treatment of diabetic eye disease. So it would be quite useful to look at my previous video of what diabetic eye disease is prior to seeing this video. It needs to be caught at an early stage, and hence screening is vital with an annual review of all diabetics. Good blood sugar control and good blood pressure control are also vital in reducing progression of and the development of diabetic eye disease. And the problem is one at the level of the capillary, the fine blood vessels where exchange of oxygen and nutrients occur within the retina. And the capillary can only do one of two things. It can either become leaky or it can become blocked. If we first look at the leakage side of the equation, leakage tends to occur in the central part of the retina, or the macula, the area used when we look directly at something. And these leaky blood vessels result in swelling of the retina, and therefore this results in a gradual blurring of vision. Sometimes the leakage is only in a few small areas within the macula, and this is adequately treated with what's called focal laser treatment, where laser is applied to burn the leaky blood vessels to stop them from leaking. If there is more diffuse leakage within the macular area, laser is still an option, but the laser is applied in a grid fashion to the area of swelling. Laser has been around for many years, but it does have some drawbacks. It is destructive, and the little scar that is produced at the time of the laser shot can gradually enlarge with the passage of time and increase a loss of vision. It also cannot be applied if you have waterlogging of the very centre of the retina, called centre-involved macular edema. Because the laser is destructive, you cannot apply laser to the very centre of the retina, as this would result in an immediate loss of central vision. Fortunately, recently, new treatments have become available with the anti-VEGF drugs, Lucentis, Avastin and Eylea, which have been shown to be very effective in reducing leakage from diabetic leakage, and has previously been shown to be very effective for several years now in reducing leakage in a different condition of wet macular degeneration. So nowadays, patients with leakage in the central retina may well be given a course of these injections with a very fine needle under local anaesthetic drops as a day case procedure in order to treat the swelling, cause the swelling to reduce and the vision improve. If blockage is a problem, this primarily affects not the central part of the retina, but the peripheral retina. So you can in fact have relatively extensive blockage to the peripheral circulation, and it go unnoticed if your central retina is functioning well. Sometimes fluorescein angiography needs to be performed, which is an injection of dye into a vein in the arm, which then circulates throughout the bloodstream in order to assess the peripheral retinal circulation to see if there is evidence of poor circulation. And what the retina tries to do when it has this poor circulation in the peripheral retina is it tries to develop new blood vessels called proliferative diabetic retinopathy, because there is a proliferation of these new blood vessels, and you would have thought that this would be good for the retina. But unfortunately, these new blood vessels do not benefit the situation. They grow from the retina into the jelly that occupies the main eye cavity, the vitreous cavity, and the vitreous jelly can pull on these abnormal blood vessels and cause them to rupture, and you suddenly can get an extensive hemorrhage into the main eye cavity, causing increased floaters and blurring of vision. So it's very important to try and catch this situation before these abnormal blood vessels have developed or progressed, and therefore early treatment is indicated. And the way the treatment is applied is with laser treatment to destroy the peripheral retina, which is producing this vascular endothelial growth factor, which stimulates these new blood vessels to form. And by performing extensive laser treatment to the peripheral retina, these blood vessels can regress, and the risk of this vitreous hemorrhage occurring is also reduced. If unfortunately a hemorrhage has already developed and there is a lot of hemorrhage within the eye cavity and the vision is very blurred, one can initially wait a relatively short period of time to see if it improves of its own accord so that laser can be applied. But if the hemorrhage is persistent or recurrent, an operation called a vitrectomy is required to remove all the hemorrhage to improve the vision and also to be able to apply the laser treatment at the same time.